Hey, Dr. Bob here at Proactive Wellness and Injury Center, and I have a question for you before we begin. If there was a person that you knew that was always depressed or had ongoing or recurrent infections or was in a pain a lot of the time, what vitamin do you think that he or she would be deficient in? Right? I think most of you probably said vitamin C, and you said that because I said they had recurrent infections, right? Hey, that's not the right answer. As great as vitamin C is, it's not the vitamin we're going to talk about. Actually, it's the next letter in the alphabet, vitamin D. Vitamin D is a phenomenal vitamin, and it's one that I'm going to encourage you to have checked so that you can maintain the best performance of your life. But before I get into that, hey, one of the reasons why vitamin D is so profound, it has what's known as transcription factor for over 3,000 genes. And as the genes go, they kind of determine the way you and I go as far as our response immunologically and as the well-being of our health. The transcription factors are also known as DNA docking sites. So that's what vitamin D does. It helps the genes to express themselves to their fullest potential. So look, here's a little piece of advice. You might consider going to your doctor and having your vitamin D level tested, all right? Because when you have it tested, you want to look at those numbers and make certain that you are at least above 32 in your 25 hydroxy vitamin D, okay? At least above 32, because if you're not, then that means that there's a hormone, the parathyroid hormone, isn't going to be expressing itself. And what's going to happen is if you don't have that going on, you're going to have what's known as intracellular calcium. There's going to be calcium inside the cells of your body that isn't going to be able to be voided by the body, and it's going to build up and it's going to result in cellular inflammation, which is there in many, if not all, diseases. We have cellular inflammation now, right? Okay, so you want to make sure that your vitamin D level is above 32. Now, in our office, in my office, we often use the vitamin. We test the vitamin D levels in the patients, especially if they have migraines or they have high blood pressure, fibromyalgia, even cancers. Now, look, this is my disclaimer to you in this video. I'm not treating nor am I diagnosing any diseases, and I'm not saying that we in our office treat any disease. My objective for any and every patient that comes to us is to enable their body to become as healthy as it possibly can, because in all of my years of practice I have never once healed anybody. The body's done all the work, it's achieved the goal, which was indeed helping that person to return to the best performance of their life. So that's what we do. So we look at the factors that might be impairing that body from doing that. And speaking of factors, I want to point to some risk factors of individuals today, especially regarding the COVID. Okay, because that's what's on most people's minds today, the COVID virus. I mean, good grief. We're no longer concerned about heart attacks or cancer or high blood pressure or whatever it is. It's all COVID, COVID, COVID. And people aren't living any longer. What they're doing is just existing, waiting to die or contract the COVID. And forgive me, I'm going to get off track here and I don't want to do that. But I want to share some information with you. Look, these are some risk factors. So risk factors are that means that you're at a higher potential of contracting this COVID. So look, these are who you are. If you're dark-skinned individual, and I know that there was some stuff on the internet and in the news medias and that, oh, the blacks are more, they're targeted with the COVID and oh, look, this is the problem with us in our country today. Healthcare is disgusting. It's really non-existent. Out of the 50 top industrial nations in the world, the United States ranks 48th. That's pathetic. And instead of, looking to the shot for the answer, we should be looking to the body for the answer, because that's what's that's what's doing all the work. And instead of having everybody, focused on depending on this stupid on this instead of everybody or most people depending upon the vaccine for their answer, they need to be looking to themselves because the answer is within. All right. So instead of educating the populace in how they can maintain their health, because you should never be dependent upon the government to keep you well. You should look to you to keep you well. So this is what I want to do here. Okay. And I know I've gotten off on a rabbit trail. Allow me to come back. But these people are at higher risk. If you're dark skinned, that's if you're black or of Indian descent, right? And if you're obese, now you got two strikes against you. If you're a dark person that is overweight, and if you're a dark person that's overweight and you're an older one, you got three strikes against you right there. That doesn't mean you're out. It means that your potential to getting the COVID is going to be greatly increased. But there's an answer to this. And also, if you are a dark skinned person who is overweight, who is older, and you have irritable bowel disease, or you got problems, any kind of problems with your gut, Mr. Sister, you then are right there. You got a target on your back to get, to be succumb to the COVID. Okay, but you're not alone. You're not alone. And it's not all about just one race. Hey, let's go to the white people, right? And those are the ones that are using the sunscreen so they don't get sunburned. By using the sunscreen when they go out in the sun, they're reducing the body's potential of producing the vitamin D within them because they've got the block now. They've got this barrier between the sun and the inside mechanism. Now add to that this sunscreen is a toxic chemical that their body is absorbing. That's a strike against them. And then also let's add to the list that maybe they're overweight, maybe they're older, and they too have gut problems. So you see, it's kind of balanced out. They're pretty equal. But the answer is going to be the same. And before I get to the answer, what you also want to know is that if you're an individual that uses anticonvulsants quite a bit, and or if you're an individual, probably more so, that uses prednisone derivatives. Oh my gosh. I mean, it's no wonder that people are getting sick. I mean, not just the COVID, but all kind of other disorders and diseases. Why? Because these people are already weak to begin with. So, what can you do? Well, if you're overweight, hey, you need to drop some pounds. There's nobody that's obese that's healthy. I don't care how big their smile is, they're not healthy. You can take that to the bank. If you're older, that means that your body's been through it. It doesn't respond as quickly as perhaps it used to, so you've got to fortify it. Now you've got to take some action there that maybe you neglected when you were younger. And if you have IBD, any kind of bowel disorders, then you need to have a talk with your doctor so that you can get that repaired. And if you're on the anticonvulsants or the prednisone derivatives, then you've got problems and all you're doing is throwing stuff at it. You're not really dealing with the cause. You're just trying to, suppress the effects. So you need to get healthier. How do you do that? Well, I want to go back to that vitamin D. You want to have your vitamin D level tested. And if it is below 32, look, I'm suggesting you get it even higher. You want to get it in the 70, 80 nanogram range. That's when your body's going to be humming, right? Because research has showed us, believe it or not, and I'll talk about it in another video, that most of the COVID deaths, over 85%, we find have been low in vitamin D. Get that up, okay? Hey, thanks for allowing me to share this information with you. If we can be of service, you contact our office. And until the next video, and as always, God bless.